By Mercy that we, draw our inspiration for tonight's discussion, just talking a little bit about infant mortality and some of the ways that we can practically address it in the country. And in studio to discuss that, we have Dr. Binti Kambuni. She is a medical officer. She works at Pumwani and has spent a lot of time with mothers there, delivering babies as well as sort of helping them through the transition of their new role in life. Thank you so much for joining us on the discussion. And before we talk to her, here's some facts that we'll play for you about infant mortality. Let's see if we can bring those up for you on screen. Globally, and these numbers are grim, 5.9 million children under the age of 5 years died in 2015. And then let's see if we have the other point, reducing infant mortality in Kenya. Children in sub-Saharan Africa are more than 14 times more likely to die before the age of 5 than children in developed regions. And finally, let's see if we can bring up the last point. In Kenya, neonatal deaths account for 60% of the overall infant mortality. Dr. Kambuni, we've seen the feature, the Total Care Box, and that's not what we're going to only concentrate on. But just based on that, how much of a difference can something like that make when we're trying to address the issue of infant mortality in Kenya?
Okay, I like the idea of the box. I'm hearing about it today. I think it's a fantastic idea. Something that the box offers is somewhere for the baby to sleep, which is something as health professionals we also haven't addressed enough. We find a situation where baby is put in the bed with the mother and the father, or put with other siblings, and someone can easily sleep on the baby, and we have quite a number of infant deaths coming from that that are not addressed again. So I like the idea of the box. So it gives the baby a designated area to sleep, at least until the age of 1, and it has a care package for the mother to use. So I think it's fantastic. Yeah,
it can go a long way. How can a mother increase her child's chance of survival and good health?
The first thing is taking care of herself. If a healthy mother is equal to a healthy baby, so what the mother can do initially is for just even before conception, just think, at some point in my life I'm going to have a baby. It's time to stop drinking, time to stop smoking, time to eat well, and the government has gone a long way to providing good nutrition for Kenyans through fortifying foods. They're just making food available for us. So just eating well, that's the first thing, because in the first 10 days of conception, that's when we have the neural tube forming. That's a bit technical, but that's when the baby's brain forms. So if the mother has a deficit of folic acid, then we have a problem, because by the time the baby is born, she'll have a congenital defect and an early neonatal death. So the first thing and the most important thing is for the mother to be healthy.
Let's take it back a bit and still focus on infant mortality. Why is it still a major issue in Kenya? The feature, I think, has hinted at that when it comes to poverty levels, etc. So take us through why it's still a major issue and maybe where we are as a country in addressing it.
Okay, it's a major issue because infant mortality is actually one of the main predictors of how well we are doing as a society. Currently in Kenya, we are having 39 infant deaths per 1,000 births. What does that mean? 1 in every 26 children, newborns, will die in this country. So by the age of 5, that number goes to 1 in every 19 babies dying before their 5th birthday. So it's an important thing for us to address that, because it's not only the health aspect of it, just that indicator of child mortality. We start thinking about our water sources, we start thinking about access to health care, we start thinking about what's the pollution. You know, there's a lot of fields. What is our energy sources? There are a lot of mothers using charcoal, not charcoal rather, but wood. Cooking in enclosed spaces.
So these are all linked in some way?
These are all linked to child mortality. So even before the child gets to the hospital, those are factors we need to address as a society. Also, how old are our mothers at the age of birth? If we are having someone below the age of 18, we have a higher risk of infant mortality. If we have mothers that are just delivering every year, there's no child spacing, she has maybe 2 infants, 3 toddlers, then we have a problem, because infant mortality goes up. She cannot give this one child the care the child deserves.
So all right, so those are so there's a lot of, sounds like, environmental, societal issues that tie in. You deal with a lot of mothers at a hospital like Pumwani. Some of them are very vulnerable. How much is sort of the education being highlighted to these women now before they go down this dark path? Are you seeing a difference? Are you seeing more of these mothers or women being engaged beforehand, so that eventually we have less of these cases when it comes to infant mortality?
Yes, we are, because a lot of these services are free. There have been many initiatives to encourage mothers to go for their antenatal visits. As it was shown in the feature, they have to come for 4 antenatal visits. So it's something that's ongoing, but the main problem we have, especially in our setup, is a low socioeconomic status. Our mothers are poorly educated. You know, like for instance, some of the messages could be in English and they don't speak English. Some could be in Kiswahili, they only speak vernacular. So there's just the poverty of the people we serve is the main challenge we faced.
Okay, and then, you know, at delivery, what increases a baby's chances of survival?
At delivery, it's actually the antenatal visits. We need to be well prepared before the day of delivery, because 9 months is a long time. So we need to know by the day of delivery how we are going to deliver you. Are we going to do a normal delivery or a cesarean? We need to monitor your weight. If there are any infections, which is very important, maternal infections actually are one of the leading causes of infant infections. So if there's any infection, we need to treat it beforehand. We need to have an ultrasound of the baby, at least 3 before the time of delivery. And by the time you get to the hospital, we have a full birth plan prepared for you. Yes. But
this is not as widespread as it should be. Now, on a higher level, what are some of the things that need to be done to ensure that this is something that a lot of moms or moms-to-be have access to? Because the feeling people get is, like you've said, access to information. That's not as obvious as it should be. Where's the gap? What more needs to be done to take this out to the women who really need this information?
Again, it comes down to the social determinants of health. If we have a well-educated population, people who understand the need of going to the hospital, the need of reporting when you confirm your conception, the need of taking your vitamins, the need of eating well, or just even staying in a well-aerated space so that you're not breathing secondary smoke, for instance, or like fumes from cooking and so on. So I think that would be the first step. Because the services have been provided, so we need to ask ourselves, why isn't this being taken up? So I guess that's why infant mortality actually tells us where we are as a nation with all the other factors that affect us.
All right. And finally, I know you may have alluded to it a little bit in the discussion, but the 3 most important things that an expectant mother needs to keep in mind before she delivers, what would those be? What are the 3 things that she needs to make sure she's done, or what are the 3 things she needs to check to make sure that the chances of infant mortality are extremely low?
Okay, so it's important again to go for all 4 antenatal clinics. When you go there, we are going to check your blood levels. We need to know how much your hemoglobin is, because if you have anemia, that can be very detrimental to the baby. Again, another thing that leads to infant mortality, and it's something that we also need to be prepared for, is multiple pregnancies. So the challenge with multiple pregnancies is that each child is not able to attain the standard birth weight of 2.5 kilos. So we have babies who will be they'll be low birth weight babies. So if you come to the clinic beforehand, we can do a scan, and then we know how many children to be prepared for. Yes, so that's also important. Again, she needs to, I think in my practice, what I've seen so far, mothers are not prepared for the birthing process. So there needs to be a lot of education around that. We need to tell them what you should do when, for instance, your water breaks. The media portrays water breaking as a normal birth process, but actually it's a disease. It's premature rupture of membranes, and that's another cause of infant mortality. So there needs to be a lot of education for the mother before she comes to the hospital.
Okay.
And when she comes, she needs to be prepared to deliver and be open to the option of a cesarean section. And again, not come expecting us to give a cesarean section, because we only give that if there's a problem with the baby or there's some danger for the mother.
Okay.
Yeah.
Thank you for all that insight. I think that's crucial information, and I almost feel like it's not just vulnerable moms, but a lot. There's almost like a lack of education, or it's very sporadic and ad hoc, and I feel like that, and you've said something very interesting, being prepared for the process. Yeah. Because that can also lead to trauma if you don't really know what to expect, I think. So that's all.
And something more important that I should add is breastfeeding. That's the best thing the mother can give the baby. The milk is sufficient, it's sterile, it's nutritious, it has antibodies, it protects against illness. So a mother should actually aim to breastfeed exclusively for 6 months, and to have mixed feeds up until the age of 2 years. So that's very, very important. So mothers should also be prepared for that. I think as a country we're also starting the conversation on how mothers can, working mothers can have more time with their children, so we increase their chances of breastfeeding.
A whole other conversation, but a very crucial one. Absolutely. Dr. Binti Kambuni, thank you so much for your thoughts. A medical officer at Pumwani Hospital. Remember to talk to us. Use the hashtag MondaySpecialKE on Twitter. Text us on 22422. We're back after this break.